Listeria genital infection is a rare but medically significant condition caused by the bacterium Listeria monocytogenes. While Listeria is most commonly known as a foodborne pathogen, its ability to affect the genital and reproductive systems, especially in pregnant women and immunocompromised individuals, makes it a serious public health concern. In this WUTNews Health Awareness video, we will explore Listeria genital infection in depth, including its history, causes, transmission pathways, symptoms, global spread, prevention strategies, diagnosis, treatment, and long-term complications. This video is created for education and awareness purposes only, using scientifically supported information explained in a clear and respectful manner. Alert! Before we continue, we strongly encourage you to subscribe to the WUTNews YouTube channel, where we regularly publish trusted content on sexual health, infectious diseases, and global public health awareness. Your subscription helps us save lives through education. Historical background of Listeria monocytogenes. The bacterium Listeria monocytogenes was first identified in 1926 by scientists studying unexplained infections in laboratory animals. It was later named after Joseph Lister, a pioneer of antiseptic surgery. Initially, Listeria infections were considered rare and primarily associated with animals. However, by the mid-20th century, researchers discovered that Listeria could infect humans through contaminated food, leading to severe illness, especially among pregnant women and newborns and people with weakened immune systems. Over time, medical research revealed that Listeria has a unique ability to cross protective barriers, including the intestinal lining, blood-brain barrier, and placental barrier. This characteristic explains its dangerous effects on pregnancy and reproductive health, including genital and vertical transmission. What is Listeria genital infection? Listeria genital infection refers to the involvement of the genital or reproductive system by Listeria monocytogenes. While Listeria is most commonly known as a foodborne pathogen, its ability to affect the genital and reproductive systems, especially in pregnant women and immunocompromised individuals, makes it a serious public health concern. Listeria genital infection can affect genital tissues through bloodstream spread, ascending genital tract infection, vertical transmission during pregnancy, and rare sexual or intimate contact in specific conditions. Listeria is a gram-positive intracellular bacterium, meaning it can survive inside human cells, making it difficult for the immune system to eliminate. How Listeria infects the human body. Primary route, foodborne transmission. The most common route of Listeria infection is through contaminated food, such as unpasteurized milk and dairy products, soft cheeses, ready-to-eat meats, smoked seafood, contaminated vegetables. Once ingested, the bacteria cross the intestinal lining and enter the bloodstream. Genital and reproductive involvement. Listeria can reach the genital system through hematogenous spread via blood circulation, infection of the uterus and cervix during pregnancy, transmission from mother to fetus, and rare contamination of genital tissues during intimate contact. Although sexual transmission is not common, genital involvement is clinically significant due to its consequences. Symptoms of Listeria genital infection. General symptoms. Many individuals experience mild or flu-like symptoms, including fever, muscle aches, fatigue, headache, nausea, diarrhea. Genital and reproductive symptoms. In some cases, especially in women, Listeria infection may involve pelvic pain, vaginal discharge, uterine infection, cervicitis, and genital inflammation. Pregnancy-related symptoms. Pregnant women may experience mild fever, back pain, flu-like illness, and reduced fetal movement. Warning: even mild symptoms in pregnancy can lead to severe fetal complications. Why Listeria is dangerous during pregnancy. Listeria is one of the most dangerous infections in pregnancy because it can cross the placenta, infect the fetus, cause miscarriage, lead to stillbirth, cause premature birth,
or cause neonatal sepsis or meningitis. Listeria genital involvement often goes undiagnosed until complications arise. Global distribution and affected countries. Listeria monocytogenes is found worldwide, especially in countries with advanced food processing systems. Countries with higher reported cases include the United States, Canada, France, Germany, United Kingdom, Spain, Australia, New Zealand, South Africa, Japan. Outbreaks are often linked to food contamination, but reproductive complications are reported globally. Risk factors for Listeria genital infection. People at higher risk include pregnant women, newborns, elderly individuals, people with HIV and AIDS, cancer patients, organ transplant recipients, diabetics, and immunosuppressed. Diagnosis of Listeria infection. Diagnosis usually involves blood cultures, amniotic fluid testing in pregnancy, placental examination, PCR testing, and clinical history assessment. Early diagnosis is critical to prevent severe outcomes. Treatment options. Listeria infections are treated with antibiotics such as ampicillin, penicillin, combination therapy in severe cases. Warning: Listeria is resistant to some commonly used antibiotics, making accurate diagnosis essential. Prevention and protection strategies. Individual prevention. Avoid unpasteurized dairy products, avoid raw or undercooked foods, maintain food hygiene, follow pregnancy dietary guidelines, seek medical attention for fever during pregnancy. Public health prevention. Food safety regulations, monitoring food production, public education campaigns, pregnancy screening protocols. Myths and misconceptions. Exclusive sexual transmission is extremely rare. Foodborne exposure is the main risk. Pregnancy-related risks are high. Understanding facts prevents unnecessary fear. Long-term complications. Untreated Listeria infection can lead to chronic infection, recurrent pregnancy loss, neonatal brain injury, and lifelong disability in newborns. Importance of awareness. Listeria genital infection highlights the importance of food safety, pregnancy care, and early diagnosis. Awareness can prevent tragedy. Final message from WUTNews. Listeria monocytogenes may be invisible, but its impact can be devastating. Knowledge empowers prevention, and awareness saves lives. If this video helped you understand Listeria genital infection, please subscribe to the WUTNews YouTube channel. Your subscription supports accurate health education for everyone. Like, comment, subscribe, share. Stay informed, stay protected, stay healthy with WUTNews.